everyone, this is Marika and welcome back to another session of Community Health Nursing with me. In our previous session, we have discussed about what is communication, what are the different types of communication, what are the different functions of communication, and the barriers of communication. In this session today, we are going to discuss a very interesting and a very short topic, which is health communication. Before we move on to today's topic, let us quickly recall what we have studied in our previous session. So by now, we already have understood that communication is a process of exchange of ideas, thoughts, beliefs, and values between two or more individuals. Communication helps the individual to give out the information that he or she wants to convey. Communication majorly has 5 elements, which is the sender, receiver, message, channel, and the feedback. And we have different types of communication, which includes verbal communication, non-verbal communication, formal communication, informal communication, one-way communication, two-way communication, and upward communication, downward communication, and horizontal communication. Even though communication is one of the most important things for us to survive as social beings, there are different barriers in communication. There are majorly 4 barriers in communication, which is physiological barrier, the psychological barrier, environmental barrier, and the cultural barriers. I hope you've understood the topic of communication properly. In this session, we are going to discuss about health communication. From the term itself, we can understand it is about communicating health messages. Let us see in detail what is health communication and what are the various aims and activities involved in health communication. Health communication means providing information and influencing individual as well as community decision to improve health. Health communication is a process of providing information to individuals and to communities so that as healthcare professionals, we can influence the people to take right decisions that will help them to improve their health. People need to take certain decisions, they need to follow certain kind of health behavior. As healthcare professionals, when we provide information on various health related topics and also influence the people to make the correct decision in order to improve their health, is health communication. Health communication includes verbal as well as written strategies to influence and empower individual, population, and communities to make healthier choices. So as I said, health communication is a process of providing information as well as influencing people to make decisions that will help to improve their health. Health communication includes verbal as well as written strategies to help people, to help individual, population, and community to make healthier choices. Health communication integrates components of multiple theories as well as models in order to bring the change in attitude and behavior of individual and community. In order to bring a positive change in the attitude and behavior of the people, health communication often integrates components from various theories and models. In health communication, various strategies of communication are used in order to make sure that people are aware about various health-related topics, people understand various health-related topics, and also to bring the positive change in the attitude and behavior of the people, which will in turn help the individual and the community to maintain their health as well as in health promotion. The function of health communication is information, education, motivation, persuasion, counseling, and health development. So, health communication contributes to all the aspects of disease prevention and health promotion. I hope you've understood what is health communication. Health communication is a process where healthcare providers provide information to the people, they influence and empower people, bring positive changes in their attitude and behavior in order to maintain their health or in order to enhance their health. Moving on, let us see what are the aims of health communication. The very first aim of health communication is to increase the knowledge and bring in awareness in the public about various health issues. The second aim of health communication is to influence the behavior and attitude of an individual as well as of the community. The third aim of health communication is to demonstrate healthy practices. Health communication is not just about providing information but also demonstrating healthy practices so that people understand about the importance of such practices practices and follow it in their day-to-day life. And the last aim of health communication is to demonstrate the benefit of behavioral changes. So health communication is a process where we provide information to the people we influence, as well as empower people to bring in changes in their attitude and behavior to enhance their health. We also, as healthcare professionals, have to demonstrate healthy practices to the people, as well as demonstrate the benefits of those behavioral changes. Once people understand that there are various benefits of the behavioral changes, people start to adopt those behavioral changes. Therefore, demonstrating the benefit of behavioral change is also one of the major aim of health communication. Moving on, let us see what are the activities that are involved in health communication. The first activity that is included in health communication is disseminating of health risk information. So if there is any kind of information related to health and risk to health, those kind of information are to be disseminated to the population, to the individual and to the community. The second activity that is involved in health communication is all the different types of public health messages and campaigns. Public health messages and campaigns are made for the people. So, public health messages and campaigns are also one of the major activity that is carried out under health communication. The third activity that is involved in health communication is using audiovisual aids in order to communicate the message, in order to make the message more clear and precise for the entire population. Here, the audiovisual aids are used to communicate health messages to people. Another activity under health communication is to motivate the individual to find out and use various health services available. Another activity under health communication is educating the patient, educating the individual and the community about the various public health services and healthcare system. And finally, for the community, health communication can be used in order to influence public health, advocate for policies and programs related to health, promote positive changes in the socio-economic and physical environment, and to improve the delivery of public health. With this, we've come to the end of this session. We have discussed a very short topic, which is health communication, wherein we've seen what is health communication, what are the different aims of health communication, and finally, what are the activities that are carried out under health communication. I hope the class was helpful, and I'll see you all in the next session. Thank you and have a great day ahead.